I know what you're thinking right now. You saw this title, figured it was clickbait, something ridiculous. I get it completely. But I need you to stay here for at least 2 minutes, because what I'm about to show you today is priceless. It's not a supplement, it's not a medication. It's a technique grounded in anatomy that uses an object you already have in your bathroom right now. We're talking about reactivating a specific neural pathway in the male body, a pathway that, after the age of 50, starts losing its signal. When you learn to stimulate it the right way, the result shows up in under 30 seconds. I'm not exaggerating. Stay until the end because there's a precise protocol. If you do it in the wrong spot, with the wrong pressure, you'll feel absolutely nothing. Before we go further, if you haven't subscribed to the ManStrong channel yet, hit the button now and turn on the notification bell. I post content on men's health that you won't find anywhere else. And drop a like. It helps this video reach more men who need this information and don't yet know they need it. To understand why a toothbrush works, I need you to stop thinking about erections purely as a blood flow issue. Because blood doesn't go anywhere on its own. It needs a command. It needs an electrical signal. Think of it this way. You might have a full tank of fuel, but if the spark plug is dead, the engine won't start. For many men over 50, the problem isn't a lack of blood, it's the absence of the signal that moves the blood. Between the scrotum and the anus, there's a small strip of skin that most men completely overlook. It has a technical name, the perineum. But what matters isn't the skin itself, it's what lies just beneath it. Buried directly under that skin is the pudendal nerve. Remember this name, pudendal nerve. It's the fiber optic cable of the male sexual system. It's the one that connects the brain to the pelvic floor, the scrotum, and the penis. During intimacy, this nerve sends the signal through the spinal column up to the brain saying, "We're active." And the brain responds by opening the arterial valves. Here's the problem nobody tells you at the doctor's office. With aging, this nerve gets lazy. It becomes desensitized. If you spend your day sitting down, if you haven't stimulated this area in years, the signal weakens. It's like a radio station with too much static. The brain can't pick it up, so it doesn't send the blood. The toothbrush, specifically the soft bristles, creates a texture and vibration frequency that no finger can replicate. It's fine enough to stimulate without pressing too hard. It wakes the nerve without traumatizing it. It clears the static and sends a strong, clear signal to the brain. Activate. This isn't far-fetched, it's pudendal stimulation. There's scientific literature on the neurological reflex of this area, but nobody explains it to you in a direct and practical way. That's exactly what I'm doing here today. Before the protocol, I need to protect you. Because in my experience, when a man gets excited about a technique like this, he rushes off to try it and makes exactly the mistakes that destroy the result. 4 mistakes. Write them down. Mistake 4. Aggression. More does not mean better here. The pudendal nerve sits close to the surface. If you press hard or scrub like you're cleaning a stovetop, you activate the pain receptors, the body goes into defense mode, the blood vessels constrict, exactly the opposite of what we want. We're after stimulation, not exfoliation. Mistake 3, wrong toothbrush. Picture your bathroom right now. If your toothbrush has medium or hard bristles, it's not suitable for this purpose. The skin of the perineum is far thinner than the skin of your hands. Hard bristles cause irritation. Irritation shuts down the parasympathetic response, the same system that controls erection. You need soft or extra soft bristles. Simple. Mistake 2, too much time. This is a spark, not a bonfire. If you do it for 10 minutes, you saturate the nerve. It stops responding. The sensation becomes background noise. The technique is designed for short, powerful bursts, 20 to 30 seconds. That's it. Mistake 1, wrong mental state. This is the silent killer. If you're stressed, worried, your mind somewhere else, it won't work. Know why? Because stress releases adrenaline, and adrenaline constricts blood vessels. It was designed to help you escape a predator, not to give you an erection. You can execute the technique perfectly, but if your brain is in survival mode, the signal won't get through. Now, what you came here for? The exact protocol. I'll walk you through every detail so you can do it right. Step 1. Privacy and position. You need to be alone and relaxed. You can stand, sit on the edge of a chair, or sit on the toilet with the lid down. What matters is that you have access to the perineum area and that your mind is settled. Step 2. Find the point without the toothbrush just yet. Run your hand between the scrotum and the anus. You're looking for a small area of soft skin, roughly the size of a coin. You might feel a slight ridge or simply smooth skin. This is your target zone. It's where the pudendal nerve is most accessible. Step 3. Initial contact. Take your clean toothbrush with soft bristles. It should be dry or slightly warm. Cold water creates a thermal shock that breaks concentration. Rest the bristles gently on the spot. Don't press down. I'll say it again. Don't press down. Simply feel the texture of the bristles against the skin. Step 4. The double movement. Here's the technical secret. You'll use 2 alternating movements. First, microcircles. Small, very light circular motions for 5 seconds. Second, small taps. Gently bounce the bristles up and down against the skin, also for 5 seconds. Alternate between the 2. This variation stops the nerve from adapting and tuning out the stimulus. It keeps the signal fresh. Step 5. Synchronized breathing. While you're doing this, sync with the following breathing rhythm. Inhale through the nose for a count of 4, expanding the belly, not the chest. Hold for 2 seconds. Exhale through the mouth for a count of 4. Why? Because this breathing pattern manually shifts your nervous system from stress mode, sympathetic, into relaxation and arousal mode, parasympathetic. The toothbrush wakes the nerve, the breath opens the vessels. It's a double hit. Step 6. The right timing. Do this 2 to 5 minutes before sexual activity. This is a preparation technique. You're warming up the engine. If you do it 30 minutes beforehand, the effect has already faded. It needs to be immediately before. Most men notice a tingling, warmth in the pelvis, or the beginning of an erection within those 30 seconds. If you felt nothing the first time, revisit the 4 mistakes. It's almost always the mental state or too much pressure. I need to stop for a moment here and talk to you directly. This content is reaching men from many different regions and from other countries too, and I want to know who's on the other side of the screen. Write to me here in the comments. What city are you from and how old are you? Write it like this. I'm from city. I'm age years old. Simple. I've already received messages from a 67-year-old bloke from Sydney, a 54-year-old from Melbourne, a 71-year-old from Brisbane, and many other places. This community is real. And when you comment, you give strength to another man watching in silence, too ashamed to admit he needs this information. Go on, write it. I want to take this moment to talk to you honestly. I know that watching a video with this title already takes courage. I know that dealing with this issue can make a man feel broken inside, even when he keeps appearing strong on the outside, going to work, looking after his family. I've worked with men for years. I've seen managers, tradesmen, devoted grandfathers, all of them break down during a consultation because they felt their body was betraying them. They felt like less of a man, and I always say the same thing. You're not broken, you're evolving. The body at 60 is not the body at 30, and that's completely fine. The system just needs a stronger signal. There's no shame in understanding how your own body works. There's no shame in using a tool, whether it's a tablet, a technique, or yes, a toothbrush, to get the result you deserve. The only thing that saddens me is seeing a man give up on himself out of shame to try. Intimacy isn't a luxury. It lowers cortisol, strengthens the heart, connects you to your partner. You deserve it, regardless of the year you were born. So you've got 2 options right now. You close this video, move on to the next one, and tomorrow everything stays the same. Or you head to the bathroom tonight, grab that soft bristle toothbrush, close the door, take a deep breath, and invest 30 seconds in yourself. 30 seconds. It costs nothing. It's free, it's safe, and for many men it will be the spark that reignites the flame. Give it a go today. Then come back here in the comments and tell me one thing. Did it work? Because when you share, you give hope to thousands of other men reading the comments too afraid to ask. If this video helped you, drop a like. It helps the ManStrong channel reach more men who need this information. Subscribe so you don't miss the next men's health video. Your vitality is still there. It's just waiting for the right signal. You're the one who gives it. See you next time.